Welcome back to the Introduction to Psychopathy course. In this third lecture, labelled Measuring Psychopathy, we will look at some of the clinical and non-clinical tools used to assess and measure psychopathy in forensic and non-forensic settings. After this lecture, you will be able to name some of the tools that are used to measure and classify psychopathy and individuals with psychopathy, and also show awareness of some of their benefits and limitations. Important knowledge when critiquing research studies in this area. When discussing the prevalency of psychopathy, we see that psychopaths are thought to make up only 1% of the general population. This is at great odds with forensic settings worldwide, where psychopaths are thought to make up between 15 and 25% of the prison population. Moreover, we see that people with high psychopathic traits commit more than 50% of the most serious crimes. Taken together, this data suggests that although psychopaths make up only a very small percentage of our population, those who are psychopaths commit some of the most heinous and serious crimes imaginable. Now, throughout these slides and previous lectures, we've talked a lot about the work of Dr. Robert Hare. Robert Hare's work in the most recent years has led the way in providing practitioners with a framework for objectively identifying and measuring psychopathic traits within their clients and patient groups. This has been a particular value within forensic fields, allowing practitioners to incorporate psychopathy into case formulations in a more standardized and evidence-based way. We don't just now rely on individual clinical formulations. In 2002, Hare suggested that although the etiology, dynamics, and conceptual boundaries of psychopathy continue to be the subject of debate and research, there exists a consistent clinical and empirical tradition concerning its core affective, interpersonal, and behavioural attributes. As such, Hare is taking those criterion from Dr. Hervey Cleckley and formalising them into an objective measurement. This is a key development in the field. This formulation ended up being the psychopathy checklist, including the revised version of it. Within this checklist, practitioners must be appropriately trained to converge information which is gained from both case history records and a semi-structured interview with that client. We're not just taking history records, and we're not just taking self-reports from individuals. We're drawing this information together in a very standardized way. As such, there is typically very high reliability between 2 or more experienced raters on the PCLR, which in layman's terms means that practitioners are getting these diagnoses right. The PCLR comprises 20 risk indicators, which are scored from 0 to 2 in accordance with the extent to which the item applies to the individual or patient. As such, the total scores range from 0 to 40, and these scores reflect the degree to which an individual matches the prototypical psychopath. Going back to those key indicators discussed by Dr. Hervey Cleckley in 1941. Using the PCLR as an assessment tool, the PCLR is considered to be one of the most reliable tools for the prediction of future offending behaviour amongst men and women, both within the prison setting and upon their release. We refer to this future offending as recidivism. Such individuals who score high on the PCLR are also to be more likely to reoffend at a quicker rate than those who score lower, with this recidivism being able to predict individuals' future behaviour to up to 10 years. However, one of the downsides of the PCLR is that it is typically weak in predicting sexual recidivism, such as rape or sexual assaults, especially when compared to predicting violent offences, which it is very good at. However, the propensity to predict sexual recidivism is increased when offenders score higher on the subfacet of antisocial behaviour. Now, these facets will be discussed in more detail throughout this lecture. We don't just measure psychopathy as a holistic construct, and that's important to remember going forwards. When assessing psychopathy in forensic and clinical settings, the PCLR is split into 4 distinguishable facets: Psychopathy is defined by both factor 1, interpersonal and affective components, as well as factor 2, social deviance components, which are split again into interpersonal, affective, lifestyle, and antisocial facets. A quote from Hare and Newman in 2008 suggests that the PCLR is very conceptually consistent with much of what Dr. Hervey Cleckley had to say about psychopathy. As such, we show links between the earlier literature and also the measurement tools, which are now deemed to be gold standard in terms of measuring and assessing psychopathy. Here are the facets again. Facet 1, interpersonal. Facet 2, affective. Facet 3, lifestyle. And facet 4, antisocial. Each of these facets has items attributed to it, which a clinician or an examiner will look at in comparing the case studies of offenders and also by conducting semi-structured interviews. These items include glibness and superficial charm, a grandiose sense of self-worth, pathological lying, cunning and manipulativeness, lack of remorse or guilt, shallow affect, callousness or a lack of empathy, a failure to accept responsibility, a need for stimulation, living a parasitic lifestyle, lacking realistic goals and how to get there, impulsivity and irresponsibility, as well as poor behavioural controls, early behavioural problems, juvenile delinquency, revocation of conditional release, and also aspects of criminal versatility. There are also two more items, promiscuous sexual behaviour and the use of many short-term marital relationships, which do not directly attribute to one single facet. However, these are important when devising a total score of psychopathy as mentioned by the PCLR. However, we don't just measure psychopathy in clinical and forensic settings. Many researchers, including myself, believe that psychopathy can be measured on a continuum, and as such is present, at least in some degree, within every member of society. As such, we've developed tools, self-report tools, for identifying psychopathic traits within the general population. The first, the triarchic psychopathy measure, the TRI-PM by Patrick in 2010, is a 58-item self-report measure with subscales including meanness, boldness, and disinhibition. An example item includes, I've injured people just to see them in pain. A second measure, the Psychopathic Personality Inventory Revised, the PPIR by Scott Lilienfeld and Widows in 2005, is a much larger measure at 154 items, again being self-report. Subscales differ from that of the TRI-PM and includes those of self-centered impulsivity, fearless dominance, and cold-heartedness. However, we can see that disinhibition maps very closely onto self-centered impulsivity, boldness maps closely onto fearless dominance, and meanness maps very closely onto cold-heartedness. It is important to note that although both measures very well conceptualize psychopathy, though very differently, they show only moderate relationships with total scores on the PCLR, and as such are not highly replaceable clinical tools in this fashion. A third measure has been more recently introduced by Dr. Robert Hare and colleagues in 2016, the Self-Report Psychopathy Scale, the SRP-4. The SRP-4 is a 64-item self-report measure with subscales including interpersonal, affective, lifestyle, and antisocial factors. The coy amongst you will note that these subscales map identically onto the facets of the PCLR as defined by Robert Hare. As such, this scale shows very high relationships with scores on the PCLR, and an example item includes, I've often done something dangerous just for the thrill of it. However, if we go back to Dr. Hervey Cleckley's conceptualization of psychopathy, and also the subscales and sub-items of the PCLR, we know that psychopaths, by nature, are very good liars. In fact, they're pathological liars. And as such, one of the key limitations when discussing self-reported measures of psychopathy within the general population is how much weight we can put on individual self-report responses. Are they just trying to manipulate us? Are they trying to act in a stigma-free fashion? Are they lying to us? These are extremely important considerations to make when you are assessing the quality of the data in the research outputs by other professionals. For this third activity, before we go into each of the facets of psychopathy which are described in the PCLR in more detail, I would like you to spend 5 to 10 minutes identifying which of the core facets interest you the most, and which of these core facets you think, from the outset, is the most dangerous, or which would result in the most damage to society. Again, these are affective, lifestyle, interpersonal, and antisocial. Try to write down clear reasons for your choices. This brings us to the end of this lecture. Throughout this lecture, we have identified the prevalence rates of psychopathy and assessed how these might differ between the general population and forensic settings. We have gained an understanding of how psychopathy is measured in forensic and non-forensic settings, and we have identified some of the pitfalls of measuring psychopathy within the general population, that of an inability to trust their responses. In Lecture 4, we will start to tease apart the PCLR in more detail